Here are some common abbreviations used in rheumatology. 1A, rheumatoid arthritis. 2, OA, osteoarthritis. 3, SLE, systemic lupus erythematosus. 4, AS, ankylosing spondylitis. 5, psoriatic arthritis. 6, SBA, spondyloarthritis. 7, JIA, juvenile idiopathic arthritis. 8, FM, fibromyalgia. 9, DM, dermatomyositis. 10, PM, polymyositis. 11, MCD, mixed connective tissue disease. 12, SSC, systemic sclerosis. 13, GCA, giant cell arteritis. 14, PMR, polymyalgia rheumatica. 15, CPPD, calcium pyrophosphate deposition disease. 16, NSAIDs, nonsteroidal anti-inflammatory drugs. 17, DMARDs, disease-modifying anti-rheumatic drugs. 18, TNF, tumor necrosis factor. 19, CRP, C-reactive protein. 20, ESR, erythrocyte sedimentation rate. 21, RF, rheumatoid factor. 22, ACPA, anti-citrulline protein antibodies. 23, ANA, anti-nuclear antibody. 24, MRI, magnetic resonance imaging. 25, US ultrasound. These abbreviations are frequently encountered in clinical practice and academic discussions in rheumatology. Here are 25 more common abbreviations used in rheumatology. 1, IL interleukin 6. 2, IL-17, interleukin 17. 3, TGF-beta, transforming growth factor beta. 4, IFN-GAN, interferon gamma. 5, CTD, connective tissue disease. 6, SS, Sjogren's syndrome. 7, APS, antiphospholipid syndrome. 8, HLA-B27, human leukocyte antigen B27. 9, MS, musculoskeletal. 10, PGA, physician global assessment. 11, BMD, bone mineral density. 12, DEXA, dual energy X-ray absorptiometry. 13, MTX, methotrexate. 14, HCQ, hydroxychloroquine. 15, AZA, azathioprine. 16, Lefrid. 17, RTX, rituximab. 18, ABA, abatacept. 19, SSA, Sjogren's syndrome antibody A. 20, SSB, Sjogren's syndrome antibody B. 21, CCP, cyclic citrullinated peptide. 22, CRMO, chronic recurrent multifocal osteomyelitis. 23, ANCA, anti-neutrophil cytoplasmic antibodies. 24, TJC, tender joint count. 25, SJC, swollen joint count. These abbreviations are essential for understanding rheumatology terminology in clinical and research contexts. Here are some abbreviations that have different meanings in rheumatology compared to other medical specialties. 1, RA, rheumatology, rheumatoid arthritis. Cardiology, right atrium. 2, SLE, rheumatology, systemic lupus erythematosus. Neurology, sleep latency evaluation. 3, CRP, rheumatology, C-reactive protein. Cardiology, cardiac rehabilitation program. 4, ANA, rheumatology, anti-nuclear antibody. Gynecology, anterior nasal area in relation to obstetrics and gynecology exams. 5, rheumatology, dermatomyositis, endocrinology, diabetes mellitus. 6, PMR-matology, polymyalgia rheumatica, physical medicine and rehabilitation, post-myocardial revascularization. 7, GCA, rheumatology, giant cell arteritis, cardiology, generalized coronary artery, used in describing coronary anatomy. 8, MTX, rheumatology, methotrexate, oncology, methotrexate, same abbreviation, but usage differs in context between oncology and rheumatology. 9, NSAID, rheumatology, nonsteroidal anti-inflammatory drugs. Neurology, nonsteroidal anti-inflammatory drug-induced headache in relation to medication overuse headaches. 10, IL-6, rheumatology, interleukin 6, inflammatory cytokine. Immunology, immunoglobulin light chain 6. 11, SSE, rheumatology, systemic sclerosis. Oncology, small cell carcinoma. 12, rheumatology, Sjogren's syndrome. Psychiatry, schizophrenic spectrum. 13, PS, rheumatology, antiphospholipid syndrome. Cardiology, atrial premature complexes. 14, TGF vematology, transforming growth factor beta. Oncology, tumor growth factor beta. 15, FM, rheumatology, fibromyalgia. Cardiology, fetal monitoring during labor and delivery. 16, LE, rheumatology, lupus erythematosus, orthopedics, lateral epicondylitis, tennis elbow. 17, rheumatology, juvenile idiopathic arthritis, pediatrics, juvenile idiopathic anemia. 18, RF, rheumatology, rheumatoid factor, cardiology, radiofrequency, used in ablation therapy. 19, ESR, rheumatology, erythrocyte sedimentation rate, cardiology, early systolic recoil in heart physiology. 20, CP, rheumatology, chondrocalcinosis, as in calcium pyrophosphate deposition, Neurology, cerebral palsy. 21. CRMO, rheumatology, chronic recurrent multifocal osteomyelitis. Orthopedics, complete range of motion, also used in physical therapy. 22. TJC, rheumatology, tender joint count, hospital management, the Joint Commission, formerly JCAHO. 23. DIP, rheumatology, distal interphalangeal, joints and fingers. Pulmonology, diffuse interstitial pneumonitis. 24. Rheumatology, physician global assessment. Dermatology, psoriasis global assessment. 25. SSB, Sjogren's syndrome antibody B. Cardiology, sinus bradycardia. These abbreviations highlight the importance of context when interpreting terms in different medical fields. Here are 25 more abbreviations with potential conflicts across different medical specialties. 1. TAR, Rheumatology, American College of Rheumatology, Radiology, American College of Radiology. 2. Rheumatology, Autoimmune Endocrinology, Adrenal Insufficiency. 3. ALP, Rheumatology, Alkaline Phosphatase, Hematology, Acute Lymphoblastic Leukemia, AL phase. 4. AP, Rheumatology, Antiphospholipid, as in APS, Surgery, anteroposterior directional term. 5. CNS rheumatology, central nervous system, as in CNS lupus. Neurology, central nervous system, common term, but usage differs in the context of neurospecific diseases. 6. COX rheumatology, cyclooxygenase, as in COX inhibitors. Pharmacology, cytochrome oxidase. 7. CT rheumatology, connective tissue, as in CT diseases. Radiology, computed tomography. 8. DMARD rheumatology, disease-modifying anti-rheumatic drug. Infectious diseases, drugs of multi-drug resistant antimicrobial therapy. 9. DX, rheumatology, diagnosis, radiology, diagnostic imaging. 10. ENT, rheumatology, ear, nose, throat, in context of systemic diseases like granulomatosis. Otolaryngology, same, but focused on primary ENT disorders. 11. EU rheumatology, European League Against Rheumatism, sports medicine, exercise and ultra-endurance league athlete registry. 12. FVC, rheumatology, forced vital capacity, used in systemic sclerosis lung involvement. Pulmonology, same but more focused on pulmonary disorders. 13. GC, rheumatology, giant cell, as in GCA, infectious diseases, gonococcus, as in gonorrhea. 14. HLA, rheumatology, human leukocyte antigen, immunology, histocompatibility locus antigen. 15. HRCT, rheumatology, high-resolution computed tomography, commonly for ILD and CTD. Radiology, same, but often focused on imaging for other lung pathologies. 16. ILD-ology, interstitial lung disease, commonly in CTDs. Pulmonology, same term, but used in various pulmonary diseases. 17. IVG, rheumatology, intravenous immunoglobulin. Immunology, same, but usage differs depending on autoimmune versus immunodeficiency contexts. 18. Lab, rheumatology, lupus anticoagulant blood test. Pathology, laboratory, general medical term. 19. MRI, rheumatology, magnetic resonance imaging, commonly for joints. Neurology, same, but used for brain or spine imaging. 20. PFT, rheumatology, pulmonary function test, commonly in systemic sclerosis. Pulmonology, same, but with broader use in lung diseases. 21. RF, rheumatology, rheumatoid factor. Radiology, radiofrequency, as in imaging equipment technology. 22. Art rheumatology, rheumatology technician. Radiology, radiation therapy. 23. SSC, rheumatology, systemic sclerosis, oncology, squamous cell carcinoma. 24. TGF, rheumatology, transforming growth factor, oncology, tumor growth factor. 25. Rheumatology, total iron binding capacity. Hematology, same, but often used in anemia workup. These abbreviations are commonly used across multiple disciplines, making their interpretation highly context dependent. Here are 25 additional abbreviations with potentially different meanings across medical specialties. 1. ACE, rheumatology, angiotensin converting enzyme used in sarcoidosis. Cardiology, angiotensin converting enzyme inhibitors, ACE inhibitors for hypertension. 2. AR, rheumatology, aortic regurgitation in the context of systemic vasculitis, allergy immunology, allergic rhinitis. 3. A, rheumatology, Achilles tendonitis, cardiology, atrial tachycardia. 4. AS, rheumatology, ankylosing spondylitis, cardiology, aortic stenosis. 5. Rheumatology, a vascular necrosis. Cardiology, atrioventricular node. 6. SAW, chest x-ray, commonly used in ILD screening. Pulmonology, same, but often used for broader lung conditions. 7. Pneumatology, distal interphalangeal, joint and fingers. Pulmonology, diffuse interstitial pneumonia. 8. ECG, rheumatology, electrocardiogram to screen for pericarditis. Cardiology, same, but primarily focused on heart disease. 9. EGPA, rheumatology, eosinophilic granulomatosis with polyangiitis. Pulmonology, eosinophilic granuloma pulmonary angiitis. 10. ESR, rheumatology, erythrocyte sedimentation rate. Oncology, estrogen receptor status, breast cancer context. 11. FIB, rheumatology, fibromyalgia. Cardiology, atrial fibrillation, AFib. 12. Rheumatology, gastrointestinal, used in systemic sclerosis or vasculitis. Gastroenterology, same, but with a focus on GI disorders. 13. HCT, rheumatology, hematocrit, used in lab values. Oncology, hematopoietic cell transplantation. 14. IBD, rheumatology, inflammatory bowel disease in the context of SPA. Gastroenterology, same, but the primary disease focus. 15. ID, rheumatology, infectious disease, screening and immunosuppressive therapy. Infectious disease, same, but broader focus on infection management. 16. IV rheumatology, intravenous, used in drug delivery like IV steroids. Critical care, same, but general usage across medicine. 17. LDH, rheumatology, lactate dehydrogenase, elevated in muscle disease like dermatomyositis. Oncology, same, used as a tumor marker. 18. MRA, rheumatology, magnetic resonance angiography, used in vasculitis imaging. Cardiology, same, but focused on heart and vascular issues. 19. MS rheumatology, mitral stenosis, valvular heart disease in rheumatic fever. Neurology, multiple sclerosis. 20. NSA, rheumatology, nonsteroidal anti-inflammatory drugs, allergy immunology, nonspecific allergens. 21. Rheumatology, osteoporosis, pulmonology, organizing pneumonia. 22. Rheumatology, psoriatic arthritis, cardiology, pulmonary artery. 23. PN, rheumatolopathy, common in SLE or vasculitis, neurology, polyneuropathy. 24. Rheumatology per rectum, as in rectal involvement in GI vasculitis. Cardiology, pulmonary regurgitation. 25. PT, rheumatology, physical therapy. Hematology, prothrombin time. These examples illustrate the importance of context when using or interpreting medical abbreviations, as the meaning can shift significantly across different specialties. Here are 25 more examples of abbreviations with different meanings across medical specialties. 1. ARF, rheumatology, acute rheumatic fever, nephrology, acute renal failure. 2. BSA, rheumatology, body surface area used in psoriasis assessment, oncology, body surface area for chemotherapy dosing. 3. C1Q, rheumatology, complement component 1Q in lupus nephritis. Immunology, part of the complement system. 4. CK, rheumatology, creatine kinase in myositis. Cardiology, creatine kinase for cardiac injury. 5. CMV, rheumatology, cytomegalovirus, infection risk in immunosuppressed patients. Infectious diseases, same but broader focus on the virus. 6. CSA, rheumatology, cyclosporin A, immunosuppressant. Orthopedics, cervical spinal alignment. 7. DC, rheumatology, disease control, surgery, discharge, postoperative care. 8. DI, rheumatology, drug-induced, e.g., drug-induced lupus. Endocrinology, diabetes insipidus 9. Rheumatology, donor-specific antibody used in transplantation immunology. Radiology, digital subtraction angiography. 10. DVT, rheumatology, deep vein thrombosis in the context of APS. Vascular surgery, same but with a procedural focus. 11. FNA, rheumatology, fine needle aspiration for synovial fluid or nodules. Oncology, fine needle aspiration for tumor biopsy. 12. HbA1c, hemoglobin A1c, monitoring diabetes in RA or SLE patients. Endocrinology, same but primarily focused on diabetes management. 13. HSP, rheumatology, Hinoxun per pediatrics, same, but often a more specific focus on childhood vasculitis. 14. IC, rheumatology, immune complex, as in immune complex mediated diseases. Urology, interstitial cystitis. 15. IVC, rheumatology, inferior vena cava in the context of venous thromboembolism. Cardiology, same with a broader vascular focus. 16. Rheumatology, lupus anticoagulant, cardiology, left atrium. 17. LFT, rheumatology, liver function test, monitoring drug toxicity. Gastroenterology, same but primarily for liver diseases. 18. MAC, rheumatology, membrane attack complex, part of the complement system. Anesthesiology, monitored anesthesia care. 19. Rheumatology, musculoskeletal, used broadly in joint and bone conditions. Orthopedics, same, but with a focus on mechanical and structural issues. Rheumatology, nerve conduction study in peripheral neuropathy. Neurology, same, but broader use in nerve disorders. 21. PEAK, rheumatology, pulmonary arterial hypertension in systemic sclerosis. Cardiology, same, but broader focus on primary pulmonary hypertension. 22. Rheumatology, peripheral nervous system in vasculitis or lupus. Neurology, same, but general reference to peripheral nerve conditions. 23. Partial thromboplastin used in APS diagnosis. Hematology, same, but for broader coagulation disorders. 24. SLIDE, rheumatology, systemic lupus erythematosus disease activity index. Dermatology, scalp lupus erythematosus disease activity index. 25. Rheumatology, total iron binding capacity, used in anemia assessment in chronic disease. Hematology, same but with a focus on iron metabolism. These abbreviations further illustrate how terms can vary greatly in meaning depending on the medical specialty. Understanding the clinical context is key to accurately interpreting these abbreviations.